Hello and welcome to Pretty Women's Talk with Dr. Preeti. I'm Dr. Preeti, gynecologist. Today's topic is what to eat and what to avoid in pregnancy. So because pregnancy is a very precious period, every woman is very cautious and very sure of not doing the things which are not very good for pregnancy. I know that everyone knows what healthy is and everyone knows this concept of eating healthy, but let us go into the concept. So try and eat the food which is very healthy, which is very fresh and which is cooked. That's the basic thing, basic concept of eating, specifically in pregnancy. Because if any of these things causes any infections, then we need to treat it with antibiotics which may be harmful to the baby. So try and avoid outside food. If you eat together too much, then it will cause indigestion. Try to eat in portions and at intervals. So you can keep your sprouts ready in the morning and you can keep on eating every 2 or 3 hourly whenever you feel like. Do not eat for two. People are always telling women that you are not one now, you are now having, you have a child inside you and now you should be eating for the child too along with yourself. Basically, this is a completely wrong funda. The reason is, when you eat for two, basically you are actually eating too much, and then there is a very high chance that you may put in a lot of weight, and this weight is going to cause a lot of problems in the pregnancy and after the pregnancy. Like, it will cause diabetes. If there is too much of weight, it may cause problems during the delivery, and it may also cause problems like blood clots that we call as venous thromboembolism. It will also be a problem to shed down that weight after the delivery. So try and eat as per your need. Try not to eat less. Try not to eat too much. So what exactly you need to avoid in pregnancy? Try and avoid the unpasteurized cheese, because this unpasteurized cheese may have a bacteria that is called as listeria, which if causes infection can cause listeriosis, and this listeriosis can cause problems like that of miscarriage. Sometimes it may even be harmful for the life of the baby. So try and avoid the unpasteurized milk, try and avoid the unpasteurized cheese. Eat the processed cheese. If you are non-vegetarian, you can eat the meat, you can eat chicken, but try and avoid the liver and liver products in the meat, because this may cause hypervitaminosis A, which can be really problematic to the baby. Try and eat cooked meat, whether it is chicken, whether it is fish, whatever it is. Cooked meat or the raw meat has something called as toxoplasma, which is a parasite which can cause problems like that of miscarriage, also may cause problems to the baby after delivery. Try and eat the cooked eggs. Do not eat the raw eggs or the undercooked eggs like we eat in half fries and all. So try and eat the egg with egg white. If you eat egg yolk, that is also okay, because your body needs that also in pregnancy. That's not a problem, but try and eat it cooked, where it should be completely solid when you eat it. Try and eat the fruits, the salads and the vegetables, but see to it that you wash it thoroughly, because there is soil attached to this raw things that we eat, and the soil may have a lot of bacteria and all the infections that I just mentioned about, which may cause a lot of problems, specifically salmonella, which can cause indigestion and food poisoning. Avoid caffeine. See to it that your caffeine is limited to 200 milligrams per day. Try to avoid alcohol. That's the very basic thing. Try to stop alcohol. It can really cause problems with the baby's face and also with the development of the organs of the baby. So try and avoid alcohol as much as possible. If you are very much into herbal teas, try and avoid taking herbal teas more than 4 cups. So 4 cups is the maximum amount of herbal teas, if you are into it, that you should be taking. Not eat too much of spicy, too much of oily, and too much of fatty food. So excess of anything should be avoided, whether it is in pregnancy or outside the pregnancy. So on that note, I would want to say thank you very much for watching my video. I hope that this video was useful for you, and if you like this video, please like and subscribe, and we'll see you again in the next video with another very important topic on what to do and what not to do in pregnancy. Thank you very much.